Welcome to Pet's Best Friend, folks. That's right, Pet's Best Friend is back on the air with my good friend, the main man, the star of the show, Dr. Kathio, probably one of the best veterinarians, folks, in the state of Pennsylvania. Probably one of the top veterinarians in the United States, worldwide, known worldwide. It travels all over the world helping people to help animals, and guess what? At no charge to them. My good friend, Dr. Kathio, how are you?
Thank you very much, and thank you for the compliment, Mr. Lesante. And you're right. The new viewers that have not seen me before, let me tell them that I go to the different part of the world. I go to Israel, I go to Pakistan, I go to Dubai, Spain, France, England, Ireland, and all those other countries, and do my work there and teach them the advanced American knowledge. At the same time, it's a reciprocal, and I learned something from them as well.
Well, I don't know that many veterinarians. I have a relative of mine who's a veterinarian, a very good person too. She's doing a great job. But you know, people say to me, you know, well, why does he do all this stuff? I mean, what's in it for him? Well, sometimes people don't realize that the love that you have, and I know the love that you have for animals, okay, no matter what kind of animals. Of course, you know I don't like snakes, but that's another story. But you have that love for animals, and this is at your expense.
Like, I wish I could do it for everybody. I do not do for everybody. If there is an emergency, I certainly do help them. And if I have a room to pull somebody in, and I'll certainly do them. In the last 2 weeks, I had a dog that came to me, had 2 bone fractures, radius and ulna. And these people were really genuine, and they wanted to keep the dog. And somebody quoted them at $3,000 to fix the leg, but I was able to help them out as my duty to my community, and I said these people deserve, you know, to have this pet, and I had the time, I'd fix it for them. There was another dog, he had a hip problem also. It was a similar situation. I did that one, but again, when I have a time, because I have to pay lots of my own bills, yes, and I do that. I had a kitten that came to me last night. The lady, she got it from the road, and the eyes were bad. And if I did not give the medication to the kitten would have gone blind. If I could do a little bit to save the life of the animal, I will do that. And again, I will show you some problems in the eye. If it's not treated right away, it will starting to die off very quick. I would have it on the show later on. I will show you. One
of the things that I cannot get out of my head that I remember, and we're going to be doing some of the shows, folks. We're going to be doing shows at his veterinarian place. Today's a great show. We're going to show you a couple of things. But before we get to the show, I'll never forget the day we were doing the show. Sammy and I were at your place, and this truck was this accident, okay, where the dog's leg was ripped apart. I lost the leg. It was a trauma. It was an emergency. They called you. We stopped the show. And here comes this animal that I was devastated. This beautiful dog, big dog,
Australian Shepherd.
Yes, remember that? And
yes.
and you know, you were as calm as can be. I'm a nervous wreck. My son's a nervous wreck. You know, this poor dog, his leg was ripped off. He's shredded almost and everything. But the approach that you used and how you know, had everyone calm, and you did your job. And that dog is, with 3 legs, doing fantastic.
Lived his normal life.
Yes.
Normal life.
Yes. I mean, and that's where the experience and skill comes in, Doctor. And I think that's why I love you so much. You do such a great job.
Thank you very much.
Anyway, today we have an interesting show, folks. We have, well, before I start, let me just tell you, for those of you, I know a lot of you called the studio and asked for Dr. Kathio's phone number. Now, he has a website, which is very simple, Kathio.com, Kathio.com. But in Pittston, it's 570-655-2412. And in Wilkes-Barre, it's 570-821-9390, okay? So now, Doc, we're going to be talking about, we have a cat who has an eye problem. We have a dog who has mange. We have a lizard who has circulation problems. We have a cat that has ringworm. And we have a dog that you did a biopsy with, okay? So let's start with the first one, and you'll be seeing this, folks. So Andy, if you want to just run that information, what's the story about this cat who had the eye problem?
Look at the cat's eye. It's a hemorrhage, and it has also pus. If you look at it with a scope, and looks left eye looks very red, and we will compare it with the normal eye, which is on the right, on the left side of the screen. And I fixed him, and that's how it looked. Eye problems, if you have a scratch, it's an emergency. You should run down to a veterinarian or kitty eye doctors, because if it's not attended immediately, the eye will start changing its shape, and sometimes the animal can go blind, and this blindness can be prevented. The blindness occur because there's a heavy inflammatory process that gets into the eye and makes the eye opaque. And you can see how the cat was before, and this is the cat. Look at the two different eyes and this is the abnormal side. That's how the eye was before.
What happened? Got scratched?
He got scratched and got infected. And if it was treated immediately, look at back. This cat,
wow.
Yeah, if I did not do that, cat could have lost his eye. So eye injuries are called emergency. You have to go to the emergency place or call your veterinarian and have them addressed right away.
You know what always fascinates me, doctor, is when a human being has pain, they're moaning, they can express their pain, but when you see an animal, you know, how does an animal express their pain? Some people who abuse these animals, who kick them, who starve them, who I think should be shot when they do these things, these animals, how do we know the pain these animals have?
We have to recognize their pain, just like the cat I showed you that had an eye problem. It's a very painful condition, but animal is not complaining. Sometimes animal, when initially gets a trauma, they will cry and bark or something like that, and after that they remain calm, because they have some tolerance, and plus they are not like we people, you know, we have too much knowledge. Oh, we got a pain here, pain there, and moaning and crying. Moaning and crying may divert your attention, but you will still have a pain. And animals, fortunately, they resist that pain and don't exhibit. I had a dog that has a fractured and displaced bones, and he was licking you around and wagging his tail. He wasn't paying too much attention that what some nasty human being has done to the dog.
Yeah, it always amazes me. You look at, sometimes those dogs look at you, like we got another Bichon, and they look at you and they have that look in their eyes, or a cat or whatever pet, and you just wonder, you feel so sorry for them, because our emotions are transgressed to their what, you know, how they feel. Yeah,
sometimes they get very sick, they get depressed, they get calm, they don't eat, and they want to be alone, hiding somewhere else. So they're expressing that, you know, they are in a distress or pain as well.
Folks, I'm talking to Dr. Anaya Kathio. The show is called Pet's Best Friend. I'm so happy to have it back on the air again. And for those of you who would like to get in contact with Dr. Kathio, Kathio.com is his website, but it's 655-2412. Excuse me, yeah, 655-2412, area code 570, or 821-9390. This show is also on the website, our website, ssptv.com. You can just go to the shows, hit Pet's Best Friend, and you'll be able to see what we're talking about. We come back, we're going to talk about a dog who had mange, a lizard with circulation problems, and also a cat who has ringworm, and also a dog who did an autopsy or a biopsy on this particular dog. Stay with us. Welcome back to Pet's Best Friend, folks. I'm Sam Lesante, the host here. The main man, of course, is veterinarian Dr. Anaya Kathio, world-renowned veterinarian, and his offices are in Pittston and Wilkes-Barre. Now, doctor, we're going to talk about a dog here that has mange. So, Andy, if you want to run that, we could show the audience, and then you explain just exactly what this dog has.
Look at the dog has lost his hair. The skin is turning bright red. And his skin getting wrinkly. He's a young dog, about 6-month-old pit bull. Looking at the skin, a number of the diseases come into the mind, but this is a classical skin problem. You look at them and I can tell you this dog has something called demodectic mange. Happens into the animals with the low immune system or living in the contaminated area surrounding by the demodectic mange other dogs area. It can be in the local or it can be generalized. So in this case, this mange is generalized. By looking at it, you cannot make a 100% diagnosis. You take the scrapings of the skin, and the mite lives in the base of the hair follicle, and what we are removing is the deep tissue from the skin, and we will process it on the slide, take the tissue out and put it on the slide and spread it out so it's not a big huge debris. Then we will take the slide and look under the microscope and confirm that. And once the confirmation is made, we can put this dog on something called mite ban. It's a dip that kills the mite, and the dip should be applied to the animal. Sometimes we take not only one area, we take 2-3 different side of the sample. So you can see this is another side of the sample. In case one sample comes negative, you should have 2-3 slides ready for it, just to identify it. Sometimes the mite's very hard to catch the mite. Not the Demodex, but the sarcoptic or scaby type of mange also. This mange that we will see and look under the microscope. Here I am looking under the microscope and I see that there is a mite that it looks like a cigar shape, and there are quite a few of them. They are moving around. These mites are called Demodex mange mites. Look at right in the center there. There is one on the top. Okay, here I'm moving the slide. I'm looking all over the place. These mites. Actually, there are thousands and thousands of them. Oh, they are living under the skin tissue in the dog, and the body is reacting to it, and you see the redness and the scaling. And the best way to control this type of mange is to provide them 4 to 6 time of dips every 2 weeks. But when you give this dip to animal, do not rinse it off. And usually the instructions come with the mite-ban dip, and you follow the instructions and do according to the instruction on the label. And you can see there is a blood over there and the mite next to it and moving around. And we are able to, this is good technology, digital technology, we are able to take a picture of microbes under the microscope. But this is the pit bull dogs, not even a 6-month-old, and already suffering from the skin problems. And later on I will show you another skin problem that looks like a mange, but it's something different. And I will tell you what other procedure you do to identify the problem in the skin. Sometimes you can do blood tests to find a problem in the skin, sometimes you do the scrapings to do the problem in the skin, or sometimes you do the skin biopsy to do the problem in the skin. The skin is one of the largest organ in the body, and so it's subject to many, many diseases.
How's this dog doing?
This dog is doing good.
Is it?
He's doing good.
Now we have a lizard, folks, who had a circulation problem, okay? And so, Andy, if you're ready with that, there it is. There's the lizard.
See, look at these animals. They walk on the carpet, and these animals have a scale. And sometimes they pick up the fiber from the carpet or from the curtain or from your shirt or from any place, and that gets wrapped around the leg. You can see I'm taking and this cuts down the circulation. Once the circulation is cut down on the animal loses its leg and becomes a gangrenous. So you remove the gangrenous part in this case, and animals go back to the normal life again. The message here is to scaly animals should not walk any place on the carpet or any towels or any area where there's a chance that a fiber can get onto the limbs, especially in the birds as well, to wrap around, and the wrapping around will just cut down the circulation and animal will lose.
So this looks like a piece of carpet or string that got caught on this lizard, right?
Correct. That's correct.
And of course the person, that's a small lizard, it's not a big one.
Yeah.
You really can't tell, okay?
Yeah.
Did he lose his leg, or
this is a gecko, banded gecko. You can see there's a big band.
Yeah.
The big band in there.
Did he lose his leg, doctor?
He has lost because the leg turned gangrenous when there's no supply of blood to the tissue, and the tissue dies off.
Getting back to before we get to the cat who has a ringworm. Well, let's get to the cat who has a ringworm. Andy, let's put this one up as the cat who has a ringworm.
See, look at another skin lesion, and this skin lesion you can identify the organism by doing the culture or in certain lights. And it is a typical of the fungal disease called ringworm. You can see this lesion in the human, or they look like a ring. That's why it's called the ringworm. And actually, that's a fungus Microsporum canis. And animal can contact it from the dirt or from other animals, and they can pass on to the people, or people can pass on to the animals. And this is a treatable condition, but requires medication for 4 to 6 weeks. And we put him on the gracefulin. And when I put this animal on this medication, I tend to tell them to give him some greasy food. It is more effective when the animal with the medication is greasy food. So this is ringworm. See, has a typical ring on the human being.
And how do you get how does
from the cat? We got it from the cat.
So how does the human get rid of the ringworm?
Apply the medication locally. Topical medication you can apply for 4 to 6 weeks.
And the cat also has to go on medication.
Cat has to go on the medication, but in a cat we give the oral medication, because if you put it on the skin, they will lick it right out.
Okay. Now you said you also give greasy food.
Greasy food. It is more effective if you put a greasy food with the diet, with the medication that I put it on. In this particular medication, does not apply to all the medications.
Going back to when we're talking about helpful hints, for pet owners, okay? First of all, we always talk about, people, they see pets and, oh, that's pretty, well, let's buy this, or let's get this and for the kids or whatever. And we always tell them, before you buy any pet or get a pet, what are some of the things you should be really thinking about?
If you had the pet already, you already know what to do it. But sometime it's your first time to get a pet, and you think you will bring him down, and you will play with him and go to work and go to play, but things doesn't work. You have to know about the animals. You have to learn about the animals, learn about their environment, learn about their nutrition, learn about their grooming, learn about their immunization. There are lots of things to learn. Also give time to your pet and take him out for exercise or something. Some of the animals, they come on to me, they are so emaciated because they are not properly fed. Because people are cruel, they have no knowledge how much they should give. Or sometimes they are so obese because they're not giving them exercise, and they are so fat, giving them a table food and all those things. Then they want to cut their diet down, instead of taking down to the exercise, because it's simple, cut their diet down. Now the animal is fat, and you cut his nutrients down, and guess what happens? The medical problem can occur. Sometimes these two fat animals, can develop fatty liver syndrome, fatty liver degeneration, and if they don't eat. And sometimes these fat animals, you don't give them good nutrition, they can become anemic as well. So cutting the diet down is just not an answer. You can give them some exercise. Folks,
I'm talking to Dr. Anaya Kathio. The show is called Pet's Best Friend, 24/7 on SSP TV and also on Kathio.com. You can get them at 570-655-2412 and or 821-9390. We'll be back right after this. Thanks for staying with us, folks. I'm Sam Lesante, the host of Pet's Best Friend, along with the main person who is the star of the show, Dr. Anaya Kathio, world-renowned veterinarian, and very proud to say he's a very good friend of mine, like he's my adopted brother. Doc, now we're going to show a dog that you did a biopsy with, okay? Yeah. So, Andy, if you want to show this, and the doctor can explain.
Okay, this is the dog. Look at his skin. It's very red and very painful, and has been on medication from different vets, different times, and this animal is not getting better. In this case, I want to find out what is the problem in this is exactly happening. Once you remove the problem, and you will see after the treatment, the animal get better. What procedure I'm doing is doing a skin biopsy, taking a small, small little tissue of the skin and sending out to the lab. And I did that, and I find out this animal has an ongoing inflammatory process, does not have a mange, does not have the fungal disease, doesn't have the ringworm, or doesn't have another disease was identified that is ongoing inflammatory skin problem. And once the problem was identified, and I treated this animal, and you will see this animal was on many medications over a year, was not getting better. Once I identified the problem, and look at this, how good he got.
Oh.
And I treated him for the inflammatory skin problems, and look at him, not even a week, and his hairs are growing back, and all the ulceration on the skin and redness has disappeared. So now we have seen here that I have done the culture, I have done the scrapings, in this case I have done the biopsy. There are other more procedures you can do on the skin. And sometimes they say Dr. Kathio is expensive because we have to go and do the right things. And this dog was on medication for many times. Look at the difference.
Oh my gosh.
Before and after.
Yeah.
And in a week I got him back to go to normal, because I find out what was the problem going. Once you identify the problem and you get rid of the problem, an animal is back to normal. It is quite often complained from sometime people that why veterinarians are expensive. It's not that we are expensive. These are the procedures that you have to perform. You have to give anesthesia. You have to obtain the tissue, then send it out to the lab, and you have to maintain your own business or something like that one. And these cost money. This is a very frequent complaint, not only to me, to other people have told me, you veterinarians are very expensive.
Well, I think that what happens is, but just like when you go to the doctor and get MRIs or CAT scans, etc., and you look at the bills and you say, what, it's $500,000 or $1,000 or $1,500, etc. Well, you know, I saw your place and you have the latest of technology there. So that cost X amount of dollars. But in terms of expenses, you have always been fair with your prices. I don't want to get on to other people who sometimes just rip people off. I don't like that. But you've always been fair, at least from my experience, or you wouldn't be sitting here on this show. You've always been honest. You've always been fair and concerning. I got about 2 minutes left. When a good breeder is selling you an animal, the first thing they want to find out from you is, what's your lifestyle? How are you going to take care of the animal? What are you going to do? They check you out before they even sell you that dog, okay? Mm-hmm. And so it's important when you're buying a dog, no matter, or a cat or whatever, if the person doesn't ask you, where do you live? What are you going to do? How are you going to take care for this dog other than making a sale? Then you have to be a little bit suspicious.
Correct. Correct. And when the animal first come down to us and we examine the animal, we do the just gross examination. But sometimes there are certain problems in the liver or in the knee or in the hip can occur later in the life of the animals. So people bring it down animal to the veterinarian. First time the veterinarian said we don't find anything wrong. And after a few months, there is a heart problem appearing, yes. Liver is appearing, yeah. And a hip problem is appearing, eye problem appearing. There are certain diseases, they are predisposed to certain breeds. So if you are selecting the breeds, and you must learn to, about certain diseases, what kind of diseases this animal might have in their life.
Very important to know before you buy any pet, folks. Do your homework and make sure if they ask you what kind of lifestyle, who's going to take care of it, etc., then they know they're concerned about the pet. Hey, it's nice seeing you again.
Thank you very much.
Okay, Dr. Anaya Kathio, folks. Pittston Animal Hospital, also in Wilkes-Barre. 2 numbers, 655-2412 and 821-9390. Of course, the area code 570. 24/7 on the web. You can watch this anywhere in the world. SSPTV.com or Kathio.com. And we're here to educate you about pets. You have any questions or anything you'd like the doctor to discuss on the next Pet's Best Friend, please let us know at SSPTV.com. All the information is there. I'm Sam Lesante. We'll see you next time.